everyone, my name is Caitlin and I am the owner of From Bump to Baby Doula Services. In this video, it's probably going to be very quick. We're going to be talking about places to birth. So I do have all of my information here from the New Beginnings website, which is the course that I went through. So thank you to Rachel if you watched this video. So hospitals, obviously. It is the most common place to give birth. Care is most likely given by a physician and usually follows the medical model of care, which is more medicine, more interventions, that kind of stuff. Some use the midwife model, especially if it employs midwives. It is important, though, to find a hospital that fits your own beliefs and practices. The next one is birth centers. We don't have any where I live, so I've never worked with one. But I hear they're becoming a more accessible option for those that desire the midwife model of care but still feel safer with emergency care close by. Care is usually given by a midwife, but you know, things happen. If you are interested in having a birth in a birth center because you want doctors to be there just in case, but you're not sure and you have nobody to talk to, this book, Home Birth in the Hospital by Dr. Stacey Marie Kerr, absolutely amazing. I 100% recommend that book. It is so awesome. Sorry, it's a bunch of different stories about different types of births, but as stated, home birth in the hospital. So really cool book. If you're interested in that kind of thing, give that a look, see through. And of course, the last place on the list is home. So homes provide a space for women to birth that is familiar to them and comfortable. They are attended by midwives, but the degree of education and this experience differs. It is important that a woman make sure she feels comfortable with her chosen provider and with not having as easy access to emergency care. So sometimes if you don't progress and you're day 3, day 4, they're like, okay, maybe it's time to consider a C-section, and they'll drive you to the hospital and you'll end up getting that. But a lot of the time, everything is done in the home. They resuscitate the baby if need be. They deliver the baby there. Like, the hospital in most cases is still pretty far, so you have to trust that you know what the midwives are doing. If you know of any other places besides, the car on the side of the road when people are trying to make it to the hospital, just give us a shout. I know there's a bunch of different types of births as well. We'll cover that in another video. You guys have a great night.